All of my caregivers that work here have taken care of kids their entire nursing or healthcare career. And because of the COVID-19 that's going on, we have been asked to take care of patients that we usually don't take care of. So we have changed and we now take care of adult patients instead of kids.
We were really stretched and feeling the impact of our increase in patients without the caregivers to treat them. We had extra beds, but there were no extra staff to go around. So that's a really scary situation to be in.
That's a lot of patients, a lot of caregivers, a lot of equipment, a lot of supplies, and it's split between 2 floors. So how do you manage one unit all together over 2 floors? And when you've been trained to do it and you know you're supposed to do it this way, and to change it, it's very uncomfortable for these nurses. And so taking that on was huge.
We'd all trained to take care of adults, and we were all very nervous, but we were willing to do it because that's what healthcare workers do, is we step up for challenges like this.
My role in all of this was to help transition us from pediatrics, kids, to adults. Adults aren't just big kids, it's very different. So just trying to figure out what we all knew in our role and transition that into the adult world.
The pediatric nurses who are taking care of adult patients are incredible. They are stepping way out of their comfort zone, but they are committed to doing everything they can for our patients.
I've heard a lot of people say that their friends or family members have gotten COVID and they've had no symptoms. Those are the lucky ones, but they're also the ones that are spreading it to the ones that we're caring for that are very sick, that walk in with really no underlying conditions and turn really fast, and it's scary. It's very serious.
Patients are working to breathe, just working to get air in, get air out, and they're exhausted by doing so.
We are a united team, we're in this together, and I think that's the #1 thing that we say, this is why we're able to step up and do this, is because we're doing it as a team still.
I think we just all have to stay positive and work together and do our part. If we want to get back to normal, we have to all do our part and be a little bit selfless.